Cardiovascular hypertension. Hypertension is a persistent systolic blood pressure greater than or equal to 140 millimeters of mercury and a diastolic pressure greater than or equal to 90 millimeters of mercury. Nearly 1 in 3 Americans suffer from hypertension. The African American population is at a higher risk to develop hypertension and develop it at a younger age than Caucasians. And of this population, women will develop hypertension at a younger age than men. Risk factors will include obesity and a family history. Hypertension is a known risk factor for coronary artery disease and has the nickname the silent killer. It frequently has no symptoms, and approximately 30% of people don't even realize they have the disease. Hypertension can be controlled in most cases. Complications can include damage to the heart, blood vessels, kidneys, brain, and eyes, especially after the age of 50. The risk will increase as blood pressure increases. It includes heart attack, heart failure, stroke, kidney disease, and blindness. Men, especially African American men, suffer serious complications more than women. This is a list of definitions for you for normal blood pressure, prehypertension, stage 1 and stage 2. Now, some people only have occasional elevations in blood pressure and normal readings at other times. This is actually called isolated pressure elevations, and these elevations are usually caused by atherosclerosis. Two factors will determine the blood pressure: cardiac output and peripheral vascular resistance. Cardiac output is the volume of blood that's pumped by the heart in a specific period of time. It's determined by the strength, rate, and rhythm of the contraction of the left ventricle and the blood volume. Peripheral vascular resistance is the force in the blood vessels that the left ventricle must overcome to eject that blood from the heart. Resistance to blood flow is determined primarily by the diameter of the blood vessels and blood viscosity. Increased PVR is the most prominent characteristic of hypertension. Stimulation of the sympathetic nervous system causes the release of norepinephrine and epinephrine. These are also known as catecholamines, and they are vasoconstrictors. This will increase the PVR and increase the blood pressure. Vasoconstriction will also decrease blood flow to the kidneys, which will then release renin. This leads to the formation of angiotensin, which is another vasoconstrictor that stimulates the secretion of aldosterone, which promotes the retention of sodium and water, which again will result in increased blood volume, and that will contribute to an elevated blood pressure. There's two types of hypertension. First of all is primary hypertension. The risk factors are dyslipidemia, which are abnormal amounts of lipids and lipoproteins in the blood, atherosclerosis, diabetes, tobacco use, age, which is 55 for women, or 55 for men and 65 for women, family history, sedentary lifestyle, obesity, stress, overstimulation, and a family history of obesity, hypertension, or dyslipidemia. Stimulants such as caffeine, nicotine, and amphetamines may also contribute to or aggravate hypertension. Symptoms: many people don't have any symptoms, or they may have an occipital headache that's more severe when they get out of bed in the morning. Lightheadedness, epistaxis, an impaired function of the brain, heart, kidneys, or eyes. Complications include heart attack, heart failure, stroke, kidney disease, and blindness. So with a heart attack, coronary artery disease reduces the blood supply that goes to the myocardium, which can result in angina. myocardial infarction, and congestive heart failure. A sustained hypertensive episode can lead to left ventricle hypertrophy or failure. Initial indicators of renal failure are nocturia, which is the need to urinate during the night, and azotemia, which is the accumulation of nitrogen waste products in the blood. Prolonged hypertension can also constrict and damage cerebral arteries, and this puts a patient at risk for transient ischemic attacks, which are the mini strokes, and cerebrovascular accidents, the major stroke. People with hypertension are 7% more likely to suffer a stroke. We can also see narrowing of the retinal arterioles, retinal hemorrhages, and papilledema that can lead to blindness. Diagnostic tests and procedures? Well, we depend a lot on repeated findings of an elevated blood pressure. Then, when that occurs, we move on to data collection on lifestyle risk factors and comorbid disease processes. The goal of treatment is to gradually reduce the PVR and the blood pressure. Lifestyle modifications such as weight reduction, smoking cessation, sodium and alcohol restriction, exercise, and relaxation. With drug therapy, the first-line drugs are going to be your thiazide diuretics, ACE inhibitors, angiotensin II receptor blockers, and calcium channel blockers. But they may also use alpha-1 adrenergic blockers, beta blockers, central alpha-2 agonists, and other centrally acting drugs, along with direct vasodilators. Implications we need to be aware of is it's extremely important for nursing staff to be familiar with antihypertensive drugs and the assessment data that's required with each drug, such as a pulse and a blood pressure prior to administration. The table located on pages 775 to 776 in your text provides guidelines for these drugs. It is important to remember that older adults do not respond the same to drugs, and they may require an altered dose. Or these older adults can suffer from side effects that are not seen in the younger populations. If you look at table 38.4 in your book, this will provide guidelines for hypertension management. In hypertensive crises, this is a life-threatening medical emergency. Symptoms will include a severe headache, blurred vision, nausea, restlessness, and confusion. We see a diastolic blood pressure that is 130 millimeters of mercury or higher. A heart rate and respiratory rates are also going to be elevated. Malignant hypertension is a specific type of hypertensive emergency in which the diastolic pressure will exceed 140 millimeters of mercury. The cause can be the patient just stopped taking their medications. Maybe they had malignant hypertension to begin with. Hypertensive encephalopathy, eclampsia, pheochromocytoma, which is the adrenal tumor, and a CVA. Complications can include cardiac or renal damage or failure of either one, a CVA, or death. We diagnose it through the assessment of vital signs. We may see retinal hemorrhage, papilledema. We can do blood work that would include ABGs, a CBC, electrolytes, blood urea nitrogen or a BUN, creatinine, cardiac enzymes, and chest x-rays. The goal of treatment is to rapidly decrease the blood pressure to a non-threatening level. We do this with diuretics and vasodilators such as nitroglycerin, hydralazine, labetalol, phentolamine, and nitroprusside, which are all given intravenously. Oral options would include captopril, clonidine, and nifedipine. Implications: We need to be aware that in these patients suffering a hypertensive crisis, if we see nausea and vomiting, this can indicate an impending seizure or coma.